So this webinar features two WHO experts who helped to produce the new global status report on road safety. They will discuss the report's findings, new country-specific road safety data, and how journalists can use this information to engage audiences on road safety. This webinar is particularly timely because it comes just before the start of the second global high-level conference on road safety, which will be held next week in Brasilia, as many of you know. I'd like to introduce our experts. First, Dr. Tami Toroyan, who is a technical officer with the Unintentional Injury Prevention Team in the Department for Management of Non-Communicable Diseases, Disability, Violence, and Injury Prevention at WHO. Since she joined WHO in 2003, Dr. Toroyan has worked on a number of projects relating to road traffic injury prevention, most recently on the Global Status Report on Road Safety. Duncan Clark is editorial director of Kiln, an award-winning data visualization and digital journalism studio. Kiln produces interactive maps and visualizations that bring complex data and stories to life. The studio also provides data visualization training. Kiln was responsible for the data visualizations produced for the latest road safety report that was released just about 2 weeks ago. And I'd like to introduce our webinar moderators. They are Steve Sternberg, an award-winning journalist who is Deputy Health Rankings Editor at U.S. News and World Report. He has covered medicine and public health for 3 decades for leading publications including USA Today, the Atlanta Journal-Constitution, and the Miami Herald. Miguel Paz, an investigative journalist and digital media strategist who founded and is president of the Poderomedia Foundation, is based in Chile. The foundation promotes the use of new technologies to rethink journalism. Miguel, a former ICFJ Knight Fellow, recently joined the faculty of the City University of New York's Graduate School of Journalism. Also participating today are WHO Road Safety Reporting Fellows representing 25 countries. So with the support of WHO, ICFJ will hold a workshop for this select group of global journalists ahead of next week's Road Safety Conference in Brasilia. For more information about each of these fellows, please go to ICFJ's website where you can find their profiles. Some housekeeping now for you. Today's approximately 90-minute webinar will begin with short presentations by Tami Toroyan and Duncan Clark. Our moderators will open up the question and answer session with some key questions. After that, we will take questions from the WHO Road Safety Reporting Fellows and from the broader viewing community. My colleague Lindsay Wagert, who's here with me in Washington, D.C., will be monitoring our Twitter feed, which is hashtag ICFJ Road Safety. So if you'd like to send in and tweet, please do. But you can send in questions via this Zoom chat or the Twitter hashtag. So I'd like to turn this over now to Tami.
Thanks, Lisa. Thanks and welcome everybody. You can hear me okay, Lisa, right?
Yes, hear you very well, thank you.
Okay. Hi, my name is Tami Toroyan. As Elisa said, I'm a technical officer at WHO's Road Safety. I just want to take the opportunity to also introduce my colleague, Dr. Kasimiesh, who is the statistician behind this report, and I've called him in for any complicated questions that I may not be able to answer. So Elisa, I think we'll just go straight in. I'm going to do a screen share, right?
Okay.
So just to go straight into the presentation. I just want to say what I want to try to do is give you an overview of global road safety, but focusing particularly on some of the risks and interventions and the report that we've put out, how we developed the report, and how we hope you might use it. I think that working with the media over the last few years, we've come to realize that the report is very dense. There's a lot of information in there, and it's not the most accessible always when you have a 350-page report. So the idea of having the data visualization, which you'll hear about, was to make this material more accessible. And the webinar is also to guide you a little bit through how to use what is ultimately quite a dense technical report, but full of useful information. So let me just put you on screen share on. Does that work, Elisa?
Yes, it does. I hope it works for everybody. Yes.
Okay, good. I think there's some muting that might need to happen.
Okay, we'll fix that.
Thanks. Okay. All right. So just let me give you a little overview of road traffic injuries as a leading cause of death. So here you see the little green man, that road traffic crashes kill 1.25 million people every year, and up to another between 20 and 50 million are injured on the world's roads. But what's interesting here is it allows you to look at how road traffic deaths compare with malaria, tuberculosis, and AIDS-related deaths. And this just gives an indication that it's really a very important public health problem, and one that often isn't considered to be a public health issue. So often people either consider that road traffic accidents, as they're often called, are inevitable, there's a slightly fatalistic view to them, or that they're the price we have to pay if we want to have development, infrastructure development. Here you see that road traffic injuries are the 9th leading cause of death in the world. And if current things continue as they are predicted to rise to become the 7th leading cause of death by 2030. But this is at an overall level for all age groups. What I'd like to show you is this, which is road traffic injuries are the #1 cause of death for people aged 15 to 29. So these are young people, the people are starting to work, bring in living for their families, often whose lives are cut short in a road traffic crash, leaving either families to look after them, care for their disability, or short of an income. So it's really a very important public health problem, which is why WHO has taken such an interest in this issue over the last 10 years or so. Elisa, I'm still getting quite a howl back of an echo. I'm not sure where that's coming from. There's also a cost. So apart from the cost, the human life.
I'm sorry to jump in. I think it's Vi. Vi, would you mind to mute your phone? I think you're the only one who's not muted. Would you mind? Vi,
yes, I think so.
I've sent a couple of messages, but maybe it's not coming through. Vi, can you hear us? Thank you. Yeah, much better. Thanks so much.
Okay. Thanks. So the cost to the countries, it's estimated that about 3% of countries' GDP is lost to road traffic crashes, and this includes direct costs, so the costs of vehicles, and as well as hospital costs, lost opportunity costs, etc. And this can go up to 5% in low and middle income countries. And I think one of the important things to say is in many countries there aren't actually estimates of how much road traffic crashes cost a country. And this is important, I think, from a journalistic point of view, because often policymakers will listen more if there's a dollar amount and how much it's costing. And as I mentioned, it's often considered that road traffic injuries and deaths are an inevitable price to pay for development. But this really is something that is a bit of a myth that I think we should all be working to counter. What can be done? To make roads safer, long-term, sustainable manner, we really need to tackle 3 main areas. And those are to improve road user behavior, to make vehicles that are on the roads safer, for those in them and for those outside, and to make the roads safer. And in order to do that, we need what we call a forgiving system that accommodates human error. That means that while we might teach children not to run across the road at school, we need to assume that some children will be children. And therefore, as road safety professionals, we need to ensure that the drivers going around the school are going slow enough so that when that child chases a ball into the street, there won't be a serious injury. Similarly, we need to assume that some drivers will fall asleep at the wheel. If we have barriers on the side of the roads, then we can mitigate the severity of the consequences. So although road user behavior is important, the system around it has to mitigate the consequences and accommodate human error. People will drink and drive, but if they know that they're going to lose their license if they're caught, they're less likely to drink and drive. So all these things have to work together to address those 3 areas. Some of the best buys in road safety that relate to those areas are the use of seatbelts in the front seats and in the back seats to prevent injuries, to prevent people being ejected from the vehicle, the use of child restraints, laws around drinking and driving, speed reduction, particularly in areas where there are high concentrations of pedestrians or cyclists, and the use of motorcycle helmets. For those behaviours to be addressed, we need laws, we need enforcement of those laws. Laws only worth the paper they're printed on unless there is enforcement. But with enforcement, they become extremely effective tools for reducing road traffic injuries. We also need standards. So we need to make sure that the helmets being worn by motorcyclists meet a quality standard. Then we have these low-cost engineering measures, some of which are infrastructural. This means speed bumps, safe pedestrian crossings, so raised crossings, pavements, footpaths by the side of the road. We also need to make sure that vehicles are safe. So increasingly, in a lot of high-income countries, we've seen the standards increased around what features vehicles have to have in order to make them safe. And those standards need to be rolled out to all countries so that vehicles are as safe as we can make them. And obviously this is something that advances as the technology evolves. And then another area that makes an important difference is how quickly people get to hospital and the quality of care that they receive when they're at hospital. So this means, are there medical staff who are trained in trauma care at the care centre where the road traffic crash victims arrive really soon? I think, sorry, Vey, I think that it's unmuted again. If perhaps you could mute that. So our objectives in producing this global status reports is to describe what is going on in road safety around the world, but in a way that allows us to compare like with like. So we need to know, not do all these countries have a seatbelt law, but do all of them have a seatbelt law that we consider top quality? And to be able to compare the numbers of deaths, to be able to compare the numbers of deaths, we need to make sure that the type of data we have is comparable. And the idea of reporting all this is to allow countries to see what is missing in their countries, and hopefully with the support of advocates like yourselves, to stimulate action to be taken. So to identify where the gaps are. And for this, we need data. We can't act where we don't know whether there's a problem. If young people on motorcycles are the people dying in Thailand, the Thai government needs to know who's dying and where in order to be able to target that group effectively. And our aim is to monitor countries' progress, but also regional and global progress over time to see how countries are doing in implementing these measures that we've talked about. And we're lucky in the area of road safety because we have a good evidence base of what works. We have 30, 40 years of experience in a number of countries which show that when these measures are put in place, we will see a corresponding decline in road traffic injuries and deaths. So now I'd just like to talk a little bit about the findings of this latest report, which hopefully you will have had access to. The first area I'll talk about is in fatalities. And here we can see that since 2001, the number of road traffic deaths is plateauing at about 1.25 million. So this is good news in the face of increasing motorization. So in the last 3 years, we've had a 16% increase in global motorization and a 4% increase in population. So that's something positive. However, obviously 1.25 million is still an intolerably high toll for a problem that is effectively man-made, that really shouldn't be this many people dying on the world's roads when we know what needs to be done. And we have these very ambitious targets that have been set by the UN last month in September, the Sustainable Development Goals. So we really have a task ahead of us that's very ambitious, possible, but nonetheless ambitious. And the other point about the fatalities that we found in this report is that low-income countries have the highest rates, fatality rates, per 100,000 population. And this is particularly evident if we look at it by what we call the WHO regions. And here we can see that the African region has a rate of 26.6 compared to the European region that has a rate of 9.3. And in the middle, you'll see in blue the world rate at 17.4. So there really is a big difference. And what's interesting on this slide is that the African region is has a very low number of vehicles compared to the other regions in the world, and yet the risk is so much higher than the European region, which is highly, highly motorized. So in terms of road safety data, some of the information you will find in the Global Status Report This is some of the information on the deaths. So you would find the absolute numbers of deaths. So as a journalist, that's important if you're trying to write a story about your country and perhaps compare road safety, road traffic deaths compared to HIV/AIDS or tuberculosis. It's important for you to be able to compare the absolute number of deaths of those two issues. We also provide information on fatality rates per 100,000 population. And this gives you an idea of the risk of a fatality per unit of population. And this allows you to compare countries that would have different populations. So obviously you would expect more deaths to take place in China than in Switzerland because there's a different population. So comparing China's number of deaths with Switzerland's would not really be meaningful at all. And so we would be able to use the fatality rate in order to have a meaningful comparison of where the risk of a fatality on the roads is higher. We also provide information on deaths by road user type. As I mentioned, it's important to know who's dying on the roads. In the African region, 39% of the deaths are among pedestrians. In the Southeast Asian or Western Pacific, it's about 3/4 amongst motorcycles. And these are important data in order to be able to target what needs to be done properly. We provide information by country and by region, and also by income. So when we look by income, we can see, for example, as we've mentioned, that low-income countries have the highest rates, followed by middle-income countries. And we'll be able to look at whether we're more likely to find countries with perhaps good helmet laws by income or by region. There are many other ways that this data can be looked at. So you'll find other organizations might look at road traffic deaths by 10,000 vehicles or by kilometers of road. We're a health organization, and so we use an indicator of 100,000 population because it allows us to compare the risk of dying from road traffic injury with risks of other health issues like HIV/AIDS, tuberculosis, etc. So our data, even though we do publish how many vehicles there are in a country, and you could work that out, our data would be presented in a way that's comparable by comparing population rates. This gives you an example of what I mentioned earlier. So on the top left, the pie chart, this is from Denmark. So you'll see that Denmark has a lot of people cycle in Denmark. So they have 17% deaths amongst cyclists, 18% amongst pedestrians, etc. And on the right, you'll see the trend data. So countries reported to us their trends over the last 10 years. Okay, just to go into a little more detail about the death data. Who collects road safety data? It would be nice if each country just had one official source, but the truth is quite different, and depending on the country you're in, there will be different data sources that exist at a national level. So data would be provided perhaps by the Ministry of Health, by the Ministry of Transport or Police, Interior, or there may be some insurance data from insurance companies, or there may be some academic studies that have been carried out on this. And these sources, ideally, should feed into each other, but it's something for you to be aware of when you start, and if you're going to start digging up data. The other thing to be aware of is what defines a road traffic death. It sounds perhaps obvious, but different countries have different definitions. So in some countries, a road traffic death is defined as someone who dies at the scene of a crash, and those people are the only people who would be counted. That means if somebody who incurs an injury dies 3 days later, they're not included in the official statistics. In other countries, it's 7 days, it can be 15 days, 30, 35, a year. So those issues are important to be aware of. And one of the reasons that WHO recommends that police use a 30-day definition is because it's difficult for police in most countries to follow the outcome of a crash for an unlimited period of time. The other area to be aware of is that in many countries there's underreporting of road traffic fatalities. And this is partly because, quite simply, not all deaths are counted. Sometimes, as I mentioned, deaths that occur a day later won't be picked up in the statistics. Or in some big countries, they may only report on deaths for a small a sample of the population, and then they will extrapolate to come up with a total. There may also be exclusions. For example, some countries exclude deaths that occur for people in the military, or deaths amongst government officials. They're not counted in the official statistics. Or there may be political concerns. There may be reasons why the government underreports their official data. To account for all these kind of complicated areas like difference in definitions and underreporting, WHO has a process which allows us to estimate a number of deaths and be able to compare. Ultimately, we want to be able to compare the number of road traffic deaths in country A with country B. And for this, as a health organization, we rely primarily on vital registration data. So this is data of death certificates. In many countries, when you die, the death is recorded and the cause of death alongside a cause of death. And WHO receives this information, and it will say, for this country, there are 1,000 deaths, this many were road traffic deaths, this many were HIV/AIDS related, this many were tuberculosis, etc. And that data is, in many countries, is considered to be very good. But in a number of countries, this data is incomplete. And so there may be additional studies. For example, this time we had an additional study carried out by Thailand, by an academic institution, with some really good data where they had assessed the number of deaths in the country. So we may use that in our estimation. Where there are small countries, so we're talking about countries with a population of less than 150,000, WHO does not make an estimate. We use what the countries report, because these are small countries where perhaps there are a handful of people dying, and then everyone who's dying on the roads is known to the officials. So we don't estimate these kind of the countries with these small numbers. But for the countries that don't have good data on their death certificates, where we don't have additional studies, we apply a mathematical model. It's a linear regression model. And that allows us to come up with an estimate to say, in this country, the data aren't that great, but we can estimate that the number of deaths are between, let's say, 35,000 and 40,000. So we have a range, and the true figure is probably somewhere in that range. We're fairly confident about that. So this allows us to have estimates that are comparable. But it means that in our report, you may see for a particular country two numbers: the number of deaths that was reported and the number of deaths that are estimated by us. So for a country like Switzerland, these two numbers would be the same, because Switzerland has very good death data, so we don't do anything, we don't need to calculate an estimation. And I just want to show you, this is a little snip that we took from one of our country profiles, where you'll see this information explained. So on the first line, the reported road traffic fatalities for 2013, and I point this out because some countries give us data that's older. So we have to project and say, well, the trend's going up. In 2011, they had 6,500, so they probably have about this much. In this particular case, the estimate was for 2013, and you'll see there were 6,700 deaths. But you'll also see there's a little B, and that tells you that in this country, a road traffic death is defined as someone who died at the scene of a crash. And then underneath, you'll see our estimation of the number of deaths in this country, which is a fair bit higher. And then you'll see an estimated rate. So our rate of this country is 12.8 per 100,000. It's based on the estimated figure. But it does mean that you can compare the rate in this country with the rate in any other country that's taken part in this report. You'll find the same information. I didn't choose the same country, which I should have done, but at the statistical annex, where you can see, for example, the line showing the data from Nepal. So in the column, in the little circle on the column on the left, you'll see 1,744 deaths. That's what was reported to us by the official data. And then you'll see the estimated number. Our estimate is that there were 4,713 deaths in Nepal in 2013. But it's probably between the range with 95% confidence, it would be between 3,880 and 5,546. And that estimation, 4,713, gives us the rate that you see on the right of 17.0 per 100,000. So all those figures on the right-hand column means that you're comparing like with like. If you want to compare Nepal with Namibia above it at 23, etc. So that's all I'm going to say about the fatality information. But I'd like to talk a little bit about the intervention. So that means the solutions, what works. And I've mentioned already these areas: road user behaviour, safer vehicles, safer roads, and trauma care. And in our report, we have questions relating to all of those interventions to see how countries are doing in implementing some of those, some of the solutions that we know work. So the only one I'm really going to focus on today is road user behaviour. Passing laws and enforcing them is a very effective way of bringing down road traffic injuries and deaths. In the last 3 years, we've seen 17 countries that have passed new laws to bring their laws into line with best practice. And we looked at 7 behavioural risk factors. The top 5 are what we call the 5 key risk factors: speeding, drink driving, helmets, seatbelts, and child restraints. And those are key risk factors because they have a good evidence base behind them. We know what needs to be done to reduce those issues, well, reduce speeding and drink driving and increase helmets, seatbelts, and child restraints. There are 2 other issues, what we call emerging issues, which are the problem of drug driving and distracted driving, specifically using mobile phones while driving. There we know quite a lot about the risk, but less about what really works to reduce these issues. So just to take you through one particular example of these, I'm only going to talk about drink driving. In this report, we've tried to look at what is the evidence behind an issue and its solutions. So in the case of drink driving, it means, is there actually solid evidence that drinking and driving increases the risk of a road traffic crash? And then, is there evidence of what can be done? So on the first point, there is a strong body of evidence that shows that the more you drink, the higher the risk of a road traffic crash and injury. And it shows particularly that over the level of 0.05 grams of alcohol per deciliter of blood, this goes up very high. So there's a strong correlation between drinking and driving and risk. In terms of what can be done, there is also a lot of evidence around drinking and driving laws, and specifically the level at which a drink driving law should be based at. So we encourage countries to have a drink driving law, but to make sure it's based on blood alcohol concentration that's no more than 0.05 for the general population, and a lower level for young and novice drivers. And this is because there's a lot of evidence to show that young and novice drivers have a much higher risk of a road traffic crash, and that where you can make the risk, the law even tighter, you have a good chance of saving lives amongst this group, this high-risk group. So we come up with these criteria, which is that we propose and we encourage countries to have a national drink driving law, to make sure that it's not a law that is based on whether someone can walk along a straight line or touch their nose, but it's a law that's based on a very objective measure, which is the amount of alcohol in blood or in breath. And that level should be no more than 0.05 for the general population and 0.02 for young and novice drivers. So with that in mind, we take the country's law. This is the drink driving law from Brazil. And with a team of lawyers, we go through the pages and pages of these legal texts to extract whether Brazil meets those criteria. And this is how we come up with these laws. So there's a long process that we follow in order to be able to ascertain if countries meet our top criteria. Those are the countries in green. Brazil does. If they meet perhaps one of our criteria, in which case they're yellow, or if they meet neither, in which case they're red. And then in this particular map, there's an additional category of those shaded, which are countries where alcohol consumption is legally prohibited. As I mentioned, for the law to be effective, there has to be enforcement. Enforcement's absolutely critical to the success of these measures, but it's very difficult to measure. So for this report, we asked countries to self-assess how, this is a group of people who are experts in their particular country who get together to provide this information for us. And they make an assessment in this country to say that the speed enforcement of the speeding law is 5 out of 10. So I just want to flag that this is not WHO's assessment of the enforcement levels, it's the country's own assessment of the enforcement level. But it is a subjective measure. So it's not one that we do any complicated analyses with. It just gives you an indication that in this particular country, the speed law could probably be better enforced. So as journalists, what's your story? And depending on what your story is, that will determine what data you'll need. So at a first level, do you need data on absolute numbers or rates? As I said, if it's an internal story where perhaps you want to look at road traffic deaths as a health issue, you may need to know how many, the numbers compared to other issues, or you may need rates in order to allow you to compare it to other countries. Then what's in place? What interventions have you got in the country and what's missing? So the other point we wanted to make is when you're using the data, try to find the original source of the data. So we see a number of articles where people have cited other people who've cited other people. So if you can, see if you can find the original source of the road safety data. Be careful of making comparisons between countries using data that are non-comparable. And then finally, when you're talking about interventions, assess if there's any evidence behind them. We were aware of one article that was written about teaching yoga to bus drivers as a way of reducing road traffic injuries. It's a nice idea, but we don't know of any evidence to suggest it would actually lead to a reduction in road traffic deaths or injuries. So that's all. I'll just leave you with 2 links and an email address. Thanks, Elisa. I'll hand over to you.
Thank you so much. Thank you so much, Tami. I really appreciate that. We will go to questions. I am trying to figure out the Q&A portion of this platform. Apologies, it's new to us and a relatively new platform in general. In the meantime, if you do have questions, you can put them into the chat. Miguel Paz, one of our colleagues, is suggesting that you gather your questions and we can call on you to participate at the end of the session. Elena, have we seen Duncan yet? Oh, here he is. I'm promoting him to panelist right now. So I'd like to introduce Duncan Clark from Kiln, and he is going to talk to you about the data visualizations that have been done as part of this excellent status report. Duncan, can you hear us and see us?
Yep, absolutely. Let me just quickly by sharing my screen.
Okay. And yes, thank you. Okay, thank you very much.
Can everyone see my screen?
Yes, we can see it. Thank you.
Okay, great. So I'll give you a little bit of background about this interactive that we made and about me. I'm going to take you through the interactive, what it's for, why we think it's useful and interesting, how you might be able to use it. And then I guess we can have questions after that. So Kiln, I work for Kiln. Kiln is a interactive studio that makes data visualizations and maps and those kind of things. My background is as a journalist, though, at The Guardian. So I give journalist-friendly answers to any questions. So Tami and Elena from the WHO came to us and said, we're producing this report. It's got a huge amount of data in it. But the way that we currently publish it is just as big PDFs full of tables, and we'd like to do something more fun and accessible and perhaps which is kind of allows the data to be explored in a more rich way. So here's the tool that we came up with, which you can find on the WHO website. I'm going to paste the URL into the chat. Give me a second to work out how to do that. Okay, I've just pasted the URL into the chat window, so feel free to click on that and to look through it while I'm talking, or if you prefer, you can just watch me talking you through it, and then have a look at it later on in your own time. So the basic idea was to do a map, and a map that allows all these multiple data sets in the report to be visually accessible. We wanted to include not only maps that show, which countries have got a thumbs up and a thumbs down from the WHO, but also to show the raw values where relevant. If you land on the main screen like this, you'll see this navigation bar along the top. It looks a bit different if you're in a very narrow window like this, which works for mobiles and narrow embeds, but let's stick with this view for now. So you see this divides into 3 sections. We've got deaths, we've got laws, so laws which may prevent death and accidents, and then finally we've got vehicle standards. So to speak. So if we start with the deaths map, you can see what this allows you to do. I think the internet connection is struggling a tiny bit with the call and the interactive, so apologies if there are little grey patches while it loads. So you can see this is a map of the world, shaded to show the total number of fatalities in each country as a proportion of total population. So deaths per 100,000 people. There's the title of the map down here to the left. As you hover over a country, it highlights. It also shows, let me make this a little bit narrow. It also shows down on the key over here, it will highlight the relevant area in the key, so you can see the band that it's in, and that works both ways. So you can hover on the band and see immediately which countries are in which band. At any point, if you are interested to know more about what the metric that you're currently looking at is about and how the data have been measured and calculated, you can click the little info sign, which you can find here. You can also find it here and in various other places. And this will bring up a panel that gives you some core information about the current view that you're looking at. So in this case, fatalities. So the map is a bit flexible. You can look at it either in a country view like this, or you can look at it for fatalities by WHO regions. And as you hover over it, you'll see this little info box on the right pops up, and that allows you to see where the current selected highlighted region is relative to the others. So let's just go back to countries view for now, because it's a bit richer. So what you can do is use this to quickly have a look for a particular stat. So you can see here, for example, that Iran is extremely high, that Libya is exceptionally high. It's a bit of an outlier, actually. Be interesting to understand why that is. Compared to, say, Norway or Sweden, which is exceptionally low. Now, if you click on a country, that selects it, and that allows you to either click it again or to click over here and to pull up the Sweden country panel. So what this panel does is it groups all the information from across the whole interactive for that particular country, and allows you to browse it by country as opposed to by theme. So let's come back to that in a minute. So first, let's just see over here on this next menu down, you can click to see the different submetrics. So in this case, different types of road users. So you can see where the fatality rate is high, and this little interactive chart here will update to show you, for example, Sweden that I've currently got selected is towards the bottom of the list for cyclists, a little bit higher for motorcyclists, and so on. We could click the DRC and lock that, and then we could see that it's kind of middling when it comes to motorcyclists. There's no data for cyclists, quite low for pedestrians, and very high for car users. So you can get quite a lot of information just by selecting a country and clicking around. Let's have a look at some of the other themes. So here are the things that may be factors in determining what those fatality figures look like. So the 5 key risk factors that we're looking at here: drink driving, speed, helmets, seat belts, and child seats. And each one has a number of submetrics. So you'll find the good laws tab, that's basically summing up whether in the WHO's view, in their looking at their criteria, the country in question qualifies for good laws, in which case it's in green, or not, in which case it's in red. The grey countries are where there's no data available. But so you can see there at a glance, you know, which countries are performing really well and not in this particular sphere, drink driving. But you can also click in and see the underlying data that's used to make some of those assessments. So, for example, here's the general limit. This shows where in the world the drink driving BAC or BRAC rate is set for different countries. So you can see, for example, that DRC, coming back to that one again, is exceptionally high. So that's quite interesting. It's one of the few places to have a BAC-based law, but to have it set above 0 per deciliter. So that's some interesting outlier stats you can pull out right away. You could look over here. Myanmar's another one. Interesting, Romania has a higher rate than most of its neighbours. You can also see the young driver specific laws, which are a little bit different. Some countries have taken the extra step, for example, Germany here, of saying that if you're a young driver, you can't have any alcohol in your blood at all, whereas others, like the UK, make no such distinction. Speed, you can do a similar thing. Overview of which countries are scoring well for speed, and then break down the individual speed limits in these different regions. So this is a kind of interesting and quite fun way to see, for example, where in the world has different types of limits for different types of roads. So motorway, for example, you can see at a glance there, all the red countries are the ones that have decided not to have limits on their motorways. You can see Germany being an exception in the UK, but that being very common in Central Africa, for example. And you can see how that compares to urban and rural roads, and indeed whether or not there are facilities for local governments to override those rules and introduce their own. So each of these categories works in a similar way. You can see here laws about helmets, you can see laws about car seats, and you can see laws about child seats. And finally, you come over to vehicle standards. So obviously this is a little bit different because these aren't legally mandated, but what we've done is taken 7 key standards from the many that exist, and ranked the countries by how many of those key standards they've implemented so far. So you can see a big global discrepancy here. Africa generally in the 0 or 1 category, the exception of Egypt, which is extremely high scoring. So there's some interesting exceptions to regional norms that you can pull out there. Frontal impact, and these are individual specific laws that we thought were relevant and interesting. So you can see which countries, for example, insist on pedestrian protection or frontal impact protection. So that's the kind of core data. If you're interested in a particular country, the other way to look at the map, as I said before, is to click on that country. So let's click on, say, China. And then we can expand this box to see all the information about China. So this gives you additional stats you won't be able to get just from the map. So you can see not only the WHO modeled estimate of the death toll, but also the amount reported explicitly by the country. You can see, which often has the large discrepancy, as you can see there. You can compare you can use this interactive graph to see where an individual country scores relative to not just the whole world, which is the view you're currently seeing, but also to other countries in its particular WHO region. So we're seeing there China in the Western Pacific region scores slightly below New Zealand, or slightly above, should I say, because lower fatality rates, and Mongolia is the worst performer there. You can also choose to look by income, so that ignores the regions and says, let's look at all the countries with a comparable income to see how that country is doing relative to its GDP per capita. You can also change the individual view here, so you can do all of the things I just said specifically for cyclists. So you can see, for example, that China has a very high cycle rate per capita, a high cycling death rate per capita relative to others in its income group, and indeed relative to others in its region. So you can pull out some interesting factoids by browsing this interactive chart. Over here, you've got a summary of all the other factors that are shown in the maps. So the vehicle laws, the vehicle standards, should I say, and the laws relating to all these risk factors. It's worth saying that these have been designed to be print friendly. So if you want to quickly grab the the profile for your country, you can click this print button here, and it should lay it out nicely on the page with all the kind of web-specific stuff gone. So this can be a useful sort of ready reference to have on your desk. And then the other thing I wanted to show you was about how to embed this tool on your own website. So this is a tool that, although you can see here, this is living on the WHO website. What's actually happening here is this tool is being embedded on the WHO website from a Kiln server, and you are invited and indeed encouraged to embed it on your own websites, the websites where you work, blogs, wherever you like. This button up here brings up two little code fragments. One of them is specific to the view that you are currently looking at in the map. So for example, I'm looking at the moment at say, cyclists in countries and areas. So if I was to press embed now, this iframe code that I'll get here, and I'll explain a bit more in a minute about what that means, will allow me to embed that particular view just for cyclists. Or I could just embed the whole project like this. And we'd love it if as many people embed the project as possible. Quite a few people around the world have already embedded it in their own sites. And in particular, it works well if you pull out a particular view that is relevant to your audience. So for example, if you were writing for a Brazilian magazine, for example, you could go to Brazil. You could click to view all the information about Brazil. So you're now looking at the Brazil profile, and you could go to embed that particular view on your site. And what that would look like is just the same, but without the header, and it would scale to fit whichever column you put it on in your website. So just a couple more words about embedding before I pass back over for questions. Some of you will have used these kind of embed tools before. They're very straightforward. It's just like the kind of thing that you would get if you embed, for example, a YouTube video or any other kind of shareable content online. All you do is you paste this iframe code directly into your content management system on your website. So wherever you would normally be editing your text, you just paste this in as well. Some websites do not support this kind of thing, in which case an alternative would be to create an image of the tool in the view that you think is interesting and to upload that image specifically. This can be done by doing a screenshot, setting the map to a size comparable to your column, and then just doing a screenshot, which is easy to do on a Mac and a PC. We could send around some more information on that if useful. But hopefully most of you will be able to use iframes, so you would literally just copy this code and paste it in. The way that this is set to work, although you can change it if you prefer, is that the width of the embedded page is automatically set to 100%. So if you put this into a column that gets narrower and wider, for example, if that's how your website works, and the graphic will just update automatically with the page and you don't need to worry about it. You can change the height. It's currently set to 700 pixels, but you can change that if you prefer, if there's a particular view that you think would look better. And not really much else to say about that. It should be very straightforward. You're very welcome to email us at Kiln if you would like any technical assistance. If you're trying to embed it and you're struggling, that kind of thing, then it's probably best to send that straight to us because we will be able to answer the question better than the WHO. If you want to find and get in contact with us, you can find the email address for us at our website, which is just kiln.it. I think that's everything I wanted to say, but do fire questions at me. Thanks very much.
Thanks so much, Duncan. That was excellent. That was really good, and getting a lot of comments on the chat about that. So I'm actually going to turn, we're going to enter the Q&A part, and I'm going to turn this over to Steve Sternberg and to Miguel Paz, who I introduced in the beginning. Steve from U.S. News and World Report, and Miguel from Poderomedia and from the City University of New York's Graduate School of Journalism. So Steve, and let me unmute them so that you can have access to, they can ask some questions to start. Oh, Steve, you're unmuted, and Miguel, are you there?
Yes, I'm here.
Okay, great, terrific. So for this part of the program, they're going to ask, just kick off by asking a few questions, and then they will be happy to relay your questions, or they will call on you, and we'll make sure that you're unmuted, or you can unmute yourself to ask your questions once they've called on you.
Good morning, everybody. This is Steve speaking. Can you all hear me? I see thumbs up. Well, I wanted to ask the experts a very basic question about this subject. It's very common for us, and on my way in this morning, I was listening to the traffic reports on the radio, and you hear traffic reporters commonly talking about accidents. And I'm wondering if one of our experts, maybe perhaps Tami, could talk to us a little bit about how public health thinks about this concept of accidents.
Hi, thanks, Steve, for the question. Yeah, it's a challenge we've been faced for some time. The word accident, certainly in English, there are issues with when it's translated, but has this sort of slightly fatalistic meaning to it, that it just happens. There's not much we can do about it. Our view of road traffic crashes are that they're predictable, largely predictable and preventable, and so, which is why you hopefully won't find any mention of accidents in our reports. As I say, that's something that doesn't translate so well, but certainly from a public health point of view, it would be looking at the risks that increase the chances of a crash and injury, and then trying to find the evidence-based solutions that work, and then evaluate what's put in place. But it is something that comes up a lot in sort of lay language, and in some countries it's very much, it's in the hands of God. It's it's just a slightly fatalistic approach to those things, or that it's the price to pay for development, as I mentioned earlier.
So really, there is no such thing as an accident in the public
our
health
view
world.
is that it's not an accident. It's largely predictable and preventable, and it sort of explains why countries like Sweden have taken this approach to how many of these should we be able to, how many deaths are acceptable, in their view as none. So this is sort of the Swedish approach of Vision Zero, and keeping in mind Sweden is the best performing country in the world. It obviously has worked just to a large degree.
Thank you very much. Miguel, should we take turns?
Yeah. I'm just going to ask a couple questions, and then I'm going to move it towards the panelists, because there's a lot of action going on in the webinar chat with a lot of comments and questions. One question for Tami, one question for Duncan. In your presentation, Tami, you were showing the importance of measuring things that are equal or that are standardized or organized in a similar way. And that leads me to the question of which are the most common errors and misinterpretations of data that you have seen by journalists using the WHO information that we should be aware of, and we should try to avoid, when it comes to comparing things that might not be relevantly comparable. And for Duncan, would you be kind enough to show or explain a little bit to all the journalists here how you organize the information that you got from WHO to make this wonderful interactive map of information?
Okay, shall I start then?
Yes.
Okay. Well, I'll use the opportunity to draw attention to a short little brochure that we have, where we looked at a lot of the articles that were written around road safety and analysed them in terms of some of the perhaps mistakes or the myths, as we put them, that we felt less comfortable with. And that's a document that you can find on our website. The most common one we see is comparisons that are made in situations where it's really apples and oranges. So one that I remember was on the number of children in road traffic crashes in China being more than, I don't know how many times that in the US. And obviously, if you look at the population of China and the population of the US, it's quite clear what that was a very strange comparison to be making. So a common one is looking at, is journalists using absolute numbers where they should be using rates? And that's not to say that there isn't a time and a place where absolute numbers, as I mentioned, are useful. but it seems often, because the numbers are so impressive when you get, when you look at the numbers in India versus another, but obviously it doesn't take into consideration the size of the population. The other one, and this I think is a question that's raised for me, is often this view that 90% of road traffic deaths are caused by human error. What does it really mean? If I drive in a rubbish vehicle at 100 kilometers an hour on an urban road and I'm drunk, is it human error, or if there's no law and there are no safe vehicles, or is it the error of the system that's behind it? So I think sort of the way that we attribute a proportion of deaths to human error is often misguided at best. A human error, of course, and human education has an important role, but as I mentioned, the idea is to have a system that reduces the likelihood of human error. When I mean, a generation ago in the UK, it was you have a drink have one for the road. People don't do that, not because they necessarily want to be law-abiding, but because if you do, your license will be revoked for a year, and that's a real pain. So I guess it's about building, the system to allow the human behavior to be better. So that's one thing I would try to move away from, is blaming the human and saying, well, those children run out in front of the roads. I mean, that's outrageous. Children will run out in the road, but let's work on the system around it so that the human error becomes the error of the system. So I guess that's the second one. But I would draw your attention to the other 7 that are in this brochure. It's in the media brief. We can talk more about that in Brazil.
Okay, if you can share the link with us, or maybe Elisa, that would be great. We can share the link. And I hope that we're going to have you for the workshop, helping us with statistics and some parts of the data. Thank you. Duncan, please.
Yeah, could I get you to repeat your question to me, just because the internet went a little bit fuzzy at that moment?
Yeah, my question is, I mean, I'm a sort of data guy like you, so I like to look under the hood. Or allow the journalists to try to understand how you organize it. So we got a lot of information from who, right? So how you chose and organized information in order to display it in the map. Of course, sure, we're not asking for a large course, but just some basic tips.
So the basic approach was to get an enormous spreadsheet from WHO, from the statistician there. And that was arranged into lots of different tabs, and so there are lots of different references to the same countries. Now, the way we always work at Kelm when we're working with a big data set like this is to make a point of taking that raw data and automating the process so that it's ready for display, so that we're never ever manually editing cells in the data, because that can introduce errors that are difficult to trace, and also it makes it harder to update the data later. So we end up with one big spreadsheet, which is very simple, just a flat text spreadsheet, and then we plug that into a modern HTML5 web application, and we use these 3 to organize and present the information. Tami, I think we're getting a bit of noise from you there.
Sorry?
I think we're getting a bit of noise from you, sorry.
Oh, sorry, I'm sorry.
So it's basically a kind of it's just HTML and JavaScript. There's no database or anything involved, and this is our standard way of working. In fact, if anyone's got any specific questions on that, I'd be happy to follow up. But I won't want to bore you with too many technical details. But before I hand back over, can I just show you one thing that I forgot to show you, which is very pertinent to Tami's response just there. So let me just click on this and to share my screen again. So here we are on the tool again. There were 2 little icons on the menu that I brushed past and forgot to show you. One of them is very relevant to Tami's answer. So if you look here at this little graph icon, this brings you to this trends view, which shows you the change over time. And one of the various things that this little mini interactive graph allows you to do is to look both at absolute rates and per capita rates. And just to make clear quite how different these 2 statistics are, you can click here and just look at the difference. So you can see that although the lines don't tend to totally reorder, the trends are completely different looked at in the 2 ways. So Southeast Asia there, for example, the absolute number of deaths is fairly steadily rising, whereas if you go for the the rates view, you'll see that it leveled off and actually has started to decline. So it's completely crucial to consider the per capita view as well as the absolute view. This also allows you to look at the number of vehicles, which you can see is rocketing, which would be another way to normalize the data. And the last thing I didn't show you is this view, which lets you see how what all this data, this dry, complicated data means in practice in a slightly more boiled down and emotionally direct kind of way. So you can watch this going around, and based on the data for last year, which is the data on which this interactive is made, someone will die in every 20 seconds, 25 seconds. So the time it's taken me to answer this have been about kind of 5 to 10 road deaths, and there will be another one in another 15 seconds. And you can see those bubbles at the bottom are updating in real time. So assuming that the rate is average, which of course is an assumption, but a reasonable one, that the rate is steady, then you can see that already today there have been 1,870 deaths on the roads, 40,000 this month, and over 1 million this year. So it's really an absolutely extraordinary scale of problem, and I hope this helps to sort of to boil that down. You can also click and see how many cyclists have died in the last day, for example, how many motorcyclists have died in the last hour or whatever. So just today, 800 motorcyclists. Anyway, I'll pass back over.
Thank you. Steve, would you like to open up for questions with the panelists?
I would, but I have one question for Tami first. You mentioned during your discussion the Sustainable Development Goals. Can you give us a quick summary of what those are? Tami, you're on mute.
Sorry about that. Can you hear me?
Yeah.
Okay. So the Sustainable Development Goals were adopted in September, and they're sort of to take over from the Millennium Development Goals. The idea is to have a platform for action for countries around a number of issues related to development. So this is road safety wasn't included in the Millennium Development Goals, so we think this is really positive because it's basically a recognition of how important road safety is to development. So first thing is, it's great that it's in there. There are two mentions or two targets relating to road safety in Sustainable Development Goals. So one is related to cities and cities becoming having more sustainable transport, safe, accessible. The other one is a target, which I think one of your panelists has raised, which is a target of reducing the number of road traffic deaths and injuries by 50% by 2020, which, as I think the question, whoever asked the question had pointed out, given that we're only plateauing, makes it a very ambitious target indeed, because it's basically a 5-year period.
Okay,
so
thank you.
So the idea is that the countries, when something's in the Sustainable Development Goal, it becomes important to the, oops, my internet connection is unstable.
Okay.
Is that all right, Steve?
Yes, no, that's very helpful. All right, well, let's go to questions from some of the panelists. We have a question here from Nurhan. Nurhan, can you address your question? If not, I can read it through the chat.
Steve, actually, it was Robbie.
Oh, Robbie. Okay.
Yeah.
This is the question about Egypt, I think. Correct? Egypt has recently harshened penalties to drivers detected driving under the influence in a nationwide campaign that began in 2014, with a survey revealing that 24% of Egyptian drivers are driving under the influence, 24%. In the WHO report, you said that most of the laws in 159 countries adopting an anti-DUI laws are too vague. What about Egypt's law?
Okay, just to clarify, we're talking about driving under the influence of what? So when I was talking about laws being vague, I was talking about drug driving laws, not drink driving laws. So I'm not sure which one your panelist was referring to, but on drink, let's just talk about drink driving laws firstly. Egypt has a drink driving law, I'm just looking at the report, but it's not based on blood alcohol concentration. So just on the area of drink driving, where where we know more about, there's a better evidence base, there could be, there's room for improvement. In other words, passing a law that's based on a blood alcohol concentration, not as walking down a straight line or touching your nose, but something that's more objective, and making sure that that law is in line with best practice, as we've discussed. 0.05 for the general population, a lower limit. On drug driving, there is a drug driving law in Egypt. I don't have, we just looked at how many countries had laws, because when we looked at what those laws covered, most of the countries didn't specify what drugs were included. So they're too vague. They'd say driving under the influence of a narcotic is against the law. But unless you have a list of what's in that list, what's in that group, it's difficult to enforce it. And you'll need a threshold. So you'd need to know the threshold above which you would be fined or you would incur some kind of penalty. Answer the question?
Yeah, that's very very helpful. Robbie, do you want to ask your question? Can you?
Yes, please. Can you hear me?
Yes.
Yes.
First of all, thank you for this opportunity. I would like to ask Tami or Duncan if they want to answer it. The statistics show a relatively low level of traffic safety in Jordan compared to developed countries producing like large socioeconomic losses. So I would like to know, I mean, in your opinion, what are the possible countermeasures to be taken in order to improve road safety in Jordan and also limit the fatalities as well?
Okay, I mean, I wonder, it might be worth pulling up, since we've got the data visualization, maybe Steve, we could just pull up the little country profile that comes up on the map for Jordan, because there it's all nicely displayed, which is why this is so nice, because it really does allow us to condense a lot of information. But just on the, so Jordan is an estimation, so that means that there was a level of underreporting. Jordan does not fall into the group just on death data, and then we can look at this, but you'll see that the reported 768 deaths and 1,900 estimated by WHO. And if you look in the statistical annex, you'll see that there's a range. So an estimation process was carried out because the data were not considered to be of good enough quality, the vital registration data. The data reported on, the data reported on death certificates is not considered to be complete or to have good enough coverage. So the rate is high. And then if you look on the little data visualization, you can cross shows you that Jordan does not have good drink driving laws, or at least they don't meet best practice. So it's 0.08, where it should be 0.05. If you look on speed, you'll see the same thing. The speed limit is 90. 50 would be the maximum, and even that should be able to be reduced. So improving the speed laws, the urban speed laws would be one measure, for example. And I think if you click along the other risk factors, on none of those 5 factors does Jordan meet our best practice. So if you click on child seats, there is a restriction on children sitting in the front seat under a certain age, which is good, but there's no child restraint law on specific restraints that should be used by children of weight heights. If you click on helmets, please. There's a helmet law. It applies to all engines. It doesn't require, this is something we've seen quite a lot. Quite a few countries have laws, but they don't actually specify that the helmet must be fastened. And while that might seem obvious, we have had instances where people just don't figure out that they can put a helmet on their head, but they don't have to buckle it. And then finally on seat belts, the law is not required by drivers and front seat passengers or by rear seat passengers. And seat belts are a very, very effective and cost-effective way of saving lives. That's really well documented. And then if you look down, that you'll see that Jordan doesn't apply any of the 7 standard, well, any of the top 3, and I don't think any of the 7 actually, vehicle safety standards. So those would be some of the first measures, I suppose, that could be taken to make the road safer.
We have another question from Robert Cheney. Robert, can you chime in? Robert's question has to do with countries and their level of insurance.
Hello?
Hello, Robert. Is that you?
Yeah, this is Robert.
Yes. Hi, Robert.
Hello.
You want
This
to
is
go ahead?
I was curious if the data includes any reflection of how private insurance for drivers
Can I go ahead?
is applied, and whether that is a tool
Can I
that you
go ahead?
monitor for its effectiveness in changing driver behavior, where they would lose their insurance or where insurance companies would participate in particular initiatives to change driver safety.
It is an important measure, but it isn't something that we have monitored. And I should also use the opportunity, somebody asked about driver licensing, that too. There are some measures, particularly to do with licensing and insurance, that a number of our partners deal with, but they're not measures that we could assess at a global level. So when we first started this project, we did have questions on insurance in there, and we had to cull a lot of the questions where it was just difficult to get global level. So this is a really our country is the unit. A country is the unit of analysis, and we know that a lot of good road safety work takes place at a subnational level. So maybe by particular insurers, or in other areas at local municipality level, and that's just something that that's a limitation of our report, is that we couldn't capture that. So yes, it's an important area. We do have partners in the sort of international road safety, many of whom will be at the conference next week, who deal more on areas of insurance and licensing, but it's just not really an area. And certainly as WHO, we're more focused on behavioural change, public health, evaluation and behaviour change than we are on those areas.
We have a question here from Deepak Dash, and it had to do with, I'm now scrolling. Oh, you had asked about the status report estimating road crash deaths at a certain number compared to an official figure, which is a different number. Would you like to address this? Hi, Deepak. Can you ask your question?
Yeah. What I'm saying, when we're taking we know that the government has to do a lot of things, and we set a very high target.
There's a lot of background noise. I'm having a very hard time hearing. I don't know if it's maybe in your newsroom. I'm not sure.
Yeah. I'm in the newsroom. I'm in the newsroom.
Yeah. Can you just speak up then?
Yeah. So what I'm saying, when we know that the government has to do all the things, they have to play the major role. Why take a confrontation mode? They say something, we charge something, rather than come down to whatever they produce, the figure. That should be brought down. That should be rather the higher focus than pushing our own new idea or maybe new estimate. That's my thought.
Okay, Deepak, why don't you mute, and I'll read your question just to make sure that everybody heard it. And correct me if I get any of this wrong. But Deepak asked about the status report, which estimates that road crash deaths at 200,551, while the official figure is 137,572. This is what the government does not accept, and he says we're all aware that the government has the real role to play in publishing these numbers. So is there in reducing deaths? So can there be a way? I'm sorry, these questions are scrolling, and I'm losing my place here. Bear with me for 1 second. I'll get to the end. So can there not be a better option than taking governments head on when there's a discrepancy in the statistics? Did I get that right, Deepak? Yeah, okay, good.
Yeah, with India, there is a big discrepancy between the official data. I mean, actually with a number of the large countries, to be honest. But there's a big discrepancy between the official data and our estimation. And I'm sure, certainly there's a lot of evidence to suggest that where you've got high concentrations of vulnerable road users, they tend to be more underreporting, which would be the case. In terms of the process that we go through, is we try to involve the government in this estimation. So firstly, when this data is collected, there are representatives from a number of sectors involved. So ideally from Ministry of Health, Interior, Transport, maybe some academic statisticians, maybe some NGOs, and they come together to give us this data. Now then there's an estimation process in the case of India, for example. After that, we send it back to the government, and the idea is to have the government comment on it to see whether they would like to add some information, comment on the methodology. In the case of India, if I'm not mistaken, we didn't get a response on our figures. However, there have been other instances, and I'll give you one example, which is the government of Thailand. In the last report, they, I think, were a little unsettled by the fact that our estimation was higher than the official figure. However, they then commissioned a study, and they looked at health data, insurance data, police data, and it kind of triangulated. They came out with a figure that was very close to the official, to the WHO estimate. So the idea would be to try to provide this data to the government in the hope that there would be some kind of communication about perhaps data that we're missing. We have had other countries who've come back and given us additional data. But if not, to encourage a dialogue amongst local stakeholders with a view to improving the quality of that data. And that's where the journalists obviously also play an important role.
We have another question from Nurhan, who wanted to know whether you assessed Egypt's implementation to random drug tests. I think you said no. I think you said you look at whether laws exist, but you don't look at the specifics. Is that correct?
Correct. First of all, we can't assess. We can't assess a country's level of implementation, because obviously that's something that happens on the ground. We can ask countries to self-report on, let's say, how they enforce drink driving speed laws. In the case of the drug laws, we didn't even ask that, because it was so clear that we're at a much earlier, let's say that the evidence base on drug driving is still evolving. So in order for us to assess, what are we assessing against? With drink driving, we know what a good law should be. We know what a threshold level is. But for drug driving, it depends on the drug. And unless the law articulates a drug and a threshold, we wouldn't even be able to get that far. So no.
Okay, well, thank you. We have another question here from AK Azad. AK? Okay, while we're waiting for AK, I have a question for Tami having to do with these drink driving laws. Russia has a drink driving law, but I understand the Duma passed legislation which extends the grace period before which a driver will give a policeman will give you a ticket by about 20 miles per hour. So if the speed limit is 80 miles per hour, you will not get a ticket until you're driving 99. Can you comment on how to assess situations like that?
Well, this one I have actually heard about, only because WHO had in the previous 5-year period, as part of the Bloomberg Philanthropies project, a project in Russia, and this did come up. And I know that my colleagues who are legislative experts had worked with the government in Russia to suggest that this grace limit, this 20-kilometer-hour, was reduced. So in most countries, for example, in Switzerland, there's a 5-kilometer leeway. So you're doing 55 and you're okay, you're doing 56 and you get fined. So the idea would be that clearly, to be effective, a 20-kilometer limit above the limit is too much. So I know there have been discussions going on to try to get that reduced, but I'm not sure whether what's happened actually. I don't know what the outcome has been. Maybe it's ongoing.
But for journalists in country, that might be a question to ask.
Indeed.
Yeah. Okay, let's see. AK, are you there?
I can see the question from AK Azad. There are two.
Can you hear me?
Yes.
Yes.
I think we can now.
In Bangladesh, the government is very reluctant to improve, to take steps and enforce the law. Although the law is very weak and old, and I mean they are very indifferent in improving the road safety in Bangladesh. So, so as a journalist, what can we do to put pressure on the government to do enough in this sector and save lives? Thank you.
Gosh, that's a $1 million question. I mean, I think that having data is an important first step. If you have the data, we would encourage you to use the data for advocacy purposes. So I'm just looking at the data for Bangladesh. 21,000 deaths a year. I don't know how that compares with other health topics, but it may be interesting to see, and that would be information probably from the Ministry of Health, of some of the other areas that perhaps are higher up Bangladesh's priority, how that compares. It's a lot of people to be dying on the roads. And then if you look at the country profile page on Bangladesh, you'll see that they actually don't meet best practice on any of the legislative areas that we've assessed. So there's really a lot that could be done in legislation. But I think the main thing would be, we want to try to get road safety up the agenda, up the political agenda, in all the countries where it's still neglected. And one of the ways is by having a grassroots and voice, so having communities that say, why are we losing people on the roads, and using the so when a journalist writes an article about road safety in Bangladesh, that they don't focus on it as an isolated incident. They say this is one of 21,000 deaths that's taking place. What's being done to do this? Are we meeting all the UN's requirements, and looking at where the gaps are, and there are a number of gaps that could be addressed. So I guess the role as a media is trying to advocate for increased attention to an issue, but also for the quite clear gaps that could be addressed.
And I think we
Thank you very much.
Yes, AJ, we can address some of these at the seminar as well. We'll talk about ways of tackling this data and bringing it to life and telling stories that hopefully can draw attention to the issue. Tami, one thing that you mentioned that I think would be helpful for the folks on the panel would be to talk about post-crash treatment of victims. This is a critical issue. We don't have a lot of time left, so if there's any way you could just give us the flavor of concern here.
Okay.
Quickly.
It will be quick, because I don't know a lot about post-crash care, to be honest, but I would use the opportunity to tell the group, at least who are going to be in Brazil, that there will be a session on post-crash care at the conference next week, which we would encourage people to attend. With a lot of leading experts who've worked a lot in low and middle-income countries. In the report, we tried to assess a couple of things. The first thing is getting people off the roads to a hospital quickly is critical. So having an emergency response that can be activated quickly is an important first step. So in some countries, it may be a fancy ambulance getting into a hospital, but in others, it'll be a rickshaw picking someone up, but knowing where to take them. And the report talks about a couple of measures. One is having an emergency access number, so a 112 or a 911 or 999, depending where you are. But that has to actually work and trigger something to happen to be effective. So one of the things we've been doing is tracking whether countries have such a number, one number ideally, so that people remember it, rather than one for private patients, one for public people, public insurance, etc. And the other area is looking at whether the healthcare professionals are trained in emergency care. So we looked at whether nurses and doctors have any type of specialty trauma care. And those were a couple of measures that we could assess at this sort of global level. So those are a couple of things, but there's a lot more that I think I would refer you to the experts to next week to find out more about.
Okay, great. Well, I think we have just time for maybe one more question. And Beatrice Obwacha, I hope I'm pronouncing your name correctly.
Steve, can we go to the Q&A and take one of the questions from the people who are viewing?
Yes, we can. Sure.
That would be great. Thank you.
We have several questions on Cameroon. And just one is, just to find out how countries with poor road infrastructure can adequately avoid accidents caused by simply by poor road infrastructure, by obstacles or items in the roadway.
Was
Tami,
that related to Cameroon, or was that a more general question?
Well, I think you could probably answer it more generally. There's another Cameroon question that also could be answered more generally, and it was one related to Beatrice's question having to do with corruption and its impact on road safety.
Okay, let me deal with the easier one. But first, just to say, Cameroon's actually done a lot. There's a big effort going on in Cameroon to improve road safety across a number of areas, including legislation, working with media. There's quite a big civil society effort going on to work with the government, and they will be represented in Brazil. On the infrastructure, there are a number of fairly cheap infrastructural measures that can be that can be implemented. For example, speed bumps. So there are some studies that were done in Ghana. Speed bumps are a very cost-effective way of reducing crashes and related injuries. Pavements. We've had partners in Tanzania working with around schools. So that would be reducing speed, but also putting in place zebra crossings, etc. So there are a number of cost-effective infrastructural measures that can be implemented. In terms of corruption, corruption is an issue in a number of problems. It's not something that we assessed or addressed. I think building capacity within the police around the importance of road safety and enforcement. I mean, we work with the Global Road Safety Partnership, and they do a lot of police training on enforcement. So how to check up, how to conduct checkpoints, drink driving tests, etc. So I guess our work would be more to encourage, to raise the profile of the work that the police do, since it is such a critical factor to the success of road safety measures.
Okay, thanks everyone. I think we had one question which I will answer because I think we're at the end of our time. Question was to ask Tami how she rates the enforcement of laws in each of the countries. I'd refer you, I think, to the data visualization because I think that will help you begin to explore that, and we can explore it in the seminar as well. This has been a tremendous discussion. Elisa, do you have any closing thoughts or
yes, well, first I want to extend our warm thanks to Tami and Duncan for participating and for taking all this time to prepare for this webinar. So thanks so much to you. Thanks again to Elena for supporting this program, this webinar, and the workshop next week, and especially to all of you who participated today. We're thrilled. Some housekeeping things again. We will share all of your questions that were in the chat with Duncan and Tami, so that, as we noted, Tami's going to be at the workshop on Tuesday, which is terrific. So you can pelt her with questions then. And Duncan gave you his email address, but we'll share your questions with him. There'll be some, you'll be getting a lot of emails from ICFJ, and so you'll get some more. Don't forget to fill out those forms we sent, and special thanks to the people who participated who were not panelists. You hung in there, and we appreciate your attention to this webinar. We will post a video of this webinar onto YouTube, and we'll send out the links to everybody. So thanks again for your time. Elena, anything you'd like to add?
Just to thank you all for all your contribution. It was very nice, and the discussion is just amazing, the level of interest, and we so much look forward to discussing more of this in Brazil. Thank you.
Wonderful.
Thank you. Thanks very much.
Thanks all.
Thanks.
Thank you.